the 2024 Lancet Commission on Dementia Prevention might not have explicitly mentioned nutrition, but many of the modifiable risk factors are responsive, if not altogether preventable, via nutrition, such as type 2 diabetes, obesity, correct?
Changing your diet can absolutely change your blood sugar. People with diabetes, believe it or not, have twice the risk of Alzheimer's disease. Changing your diet, for example, people with high blood pressure that have a high salt diet that can increase your blood pressure. Well, less salt, great. Now, stopping salt isn't going to always fix your blood pressure, so blood pressure is a complicated topic. But I agree, you can change your nutrition patterns to address modifiable risk factors that are related to Alzheimer's disease, and that's really a great point, Max.
Okay, so following up on that, the next question was, what are the best diets for brain health? We have the MIND diet, the Mediterranean diet. Many people have likely at this point heard of the ketogenic diet. What are your thoughts?
So to me, if I'm going to choose one dietary pattern, there's dietary patterns like the Mediterranean style diet. I think to me that has the most robust evidence. The challenge here is that there's this concept called precision nutrition or personalized nutrition, where every single person probably needs to eat just a little bit differently, whether or not a person has a specific gene that increases risk of Alzheimer's called the ApoE4 variant of the ApoE gene. Maybe those people have to eat a little bit different. I think in terms of a baseball game, an analogy, in terms of nutrition and brain health, we're probably in inning 2 or 3 of a 9-inning game where we truly understand this. But in a few years from now, every person will eventually get a personalized plan. For now, to me, the greatest hits diet when it comes to Alzheimer's risk reduction, prevention, brain health overall is the Mediterranean style diet, eating lots of green leafy vegetables on a regular basis. Fatty fish are high in omega-3 fatty acids, especially people with that ApoE4 variant, 1 or 2 copies, omega-3 fatty acids. Brain healthy fats are super important to protect the brain. Dark cocoa flavonoids, berries, half a cup several times a week, really critical. Minimizing alcohol. Alcohol is just not good for the brain. It's a toxin. I just don't really advocate for too much alcohol. It just doesn't make much sense to me. A glass of wine with dinner, sure, that may be okay, but not several glasses of wine and not multiple times a week from my end anyway. So I think the Mediterranean style diet to me is the most impactful. I think there's interesting, compelling evidence. Certain people may do well with a ketogenic diet. Specific ketogenic diets may treat seizures, for example, and depending on the person and the genes and the individual biology and what the physician is suggesting, there may be other dietary patterns, but the MIND diet and the Mediterranean style diet have, in my opinion anyway, the most evidence.